Hi, everyone. This is Dr. Lazar, and thank you for tuning in. This is on our Lazar Spinal Care page, and I wanted to have a video for some important announcements regarding COVID-19 and how we are responding to that with our action plan in the office. So there have been some updates, and the minute I just got out of a meeting, a virtual meeting, of course, with my team. Everybody's working from home right now, and so I want to just go through a list of things and make sure that I touch on what's going on here. So effective immediately, it's mandated in the state of Michigan. It's an executive order that all healthcare providers are considered essential only in that they are keeping somebody out of the emergency department. So we are required at Lazar Spinal Care to close our office officially until April 30th, and we are available for emergency visits. So if there is a situation where you feel like your adjustment will keep you from going to the emergency department, certainly, call our office, let us know. We're screening that for sure. And if it's after hours, then you can hit option 2 in the voicemail greeting when it picks up, and you can come right through to my cell phone. I ultimately have to determine whether this is an emergency visit or not, which is something I just found out, because I thought, yeah, if you're not feeling great, I'll get you taken care of, and then you won't have to go to the emergency room later. But it actually has to be documented that the only other option to my care at that moment would be going to the emergency department. We do have safeguards and guidelines in the office, as we have the whole time. That's not any different. That does include, so if there is an emergency visit, that includes, we're monitoring. We have 4 screening questions we're asking before we'll schedule. We also have a thermometer at the front desk. We have all of our things spread out to 6 feet apart. We have all the guidelines that we're supposed to have, so we're compliant for sure if you do need to come in. Now, regarding your care, we certainly value everybody that comes in as family, and so we want you to know we're going to treat you like family for sure. We'll miss you. I have some plans to stay connected remotely and be available remotely for things, but nothing will happen with your care. In other words, you're not going to be out anything by this mandated closure. The any care that was scheduled for the month of the end of March and the beginning of April will just be extended. If your care plan ended at a certain time, we will extend it beyond there. If you need additional visits as a result of kind of falling off of your schedule, we will evaluate that as a case-by-case basis and act in your best interest, so that if you need a few extra adjustments to get back up to speed, we can certainly do that, and we don't want that to be a financial hardship for you. So you'll pick up right where you left off. You're not going to lose anything at all. We're totally all in this together. My staff in their entirety is out right now. Nobody's sick, thank God. Nobody has any known exposure to anybody with coronavirus, but as a safety precaution, we are having our entire team stay home, and I don't require them to monitor things or anything like that out of ethical requirements for payroll and things. So I personally will be checking voicemails and emails, and so what that means for you is I would ask for your grace and patience. I certainly believe in treating people the way I want to be treated, so we're not going to leave you hanging by any means. It's just that for various reasons, we can't have staff doing stuff on the phone or responding to email. And so I will be handling that, but I will get back to you. So the ways you can get a hold of us: you can call the office and leave a message, 734-274-5107. I'll be monitoring voicemail periodically. Also, you can email the office, care@lazarspinalcare.com, care at LAZARSPINALCARE.com. I will make sure that I respond to those. You can also text the office. In fact, I'm going to grab that number. It's the same number that you get appointment reminders on. And so let me pull that up. It is 734, I can tell you that, Let me pull this up for you. Let's see. Well, I will post that in here. It's the same number that you get appointment texts through. So I will post that number up here, but you can just reply to those. If you have our scheduling app, you can send messages through there as well. So anything we can do to serve you. I do have a webinar Thursday evening at 7 o'clock. I'll post a link for that in this video as well. That's free, and it's 8 tips of things you can do, 8 secrets to eliminate low back pain. And so hopefully this will just be a short stint. We are totally here for you guys. I am so sorry, because my heart is to be there with you. I want to boost your immune systems. I want to get your families taken care of. I want to help you through this stressful situation. In fact, I can't think of a better time to do it. But we do have to follow, legal requirements, and certainly we don't want to do anything that puts our future ability to serve you and your family in jeopardy. So we're here for you. Please ask any questions. This Thursday I'll be doing a webinar, and let me know how that goes. And then I'll be doing weekly webinars on some topic where we can all, where I'll be available, to serve. I also have virtual consultations available for telemedicine. So if you have any questions at all, just email our office, and then we can send you a calendar link to that, where if you have questions, I'm more than happy to serve you. So just because you can't come in doesn't mean that we're not here for you. And I tell you, big hugs to everybody. We already miss you tremendously, and we cannot wait to get back in and get you guys taken care of. So we love and appreciate you all, and we're looking forward to serving you from a distance for the next couple of weeks, and then getting right back at it as soon as we can. All right, talk to you soon. Thanks so much.